Thank you, Mr. Chairman, and I want to thank our witnesses for testifying before the subcommittee today. There are many topics, such as prior authorization, which we just heard about, and denial of claims, which the majority of which are later approved without modification, that I'd like to discuss with our witnesses today. But unfortunately, or fortunately for you all, I only have 5 minutes, so I'm just going to jump in. As a physician and veteran and a former director of public health, I strongly support innovation in healthcare delivery, but every dollar wasted on inefficiency, waste, denial of claims, or unnecessary billing is a dollar not spent on patient care. That's why Senator Grassley's recent report detailing United Health Group's conduct in the Seniors Health Insurance Advantage plans, commonly known as Medicare Advantage, that report is very troubling. I've had many doctors within the state, and I myself have experienced what is happening when patients come back after having visited at home. Medicare Advantage was created to improve outcomes and coordinate care for seniors, not to incentivize gaming the system. Do any of your companies decide a claim for a level of care without documentation or justification for the level of service or test or imaging? The answer to that is no. You require documentation. The independent federal oversight reports from HHS OIG have identified that conditions, including congestive heart failure, were among diagnoses often added via in-home assessments or chart reviews in Medicare Advantage. So if you would deny a claim from a provider without documentation, why is it that you feel at liberty to submit a claim to CMS for a diagnosis based on a home visit? Congestive heart failure is not a paperwork diagnosis. It's a serious, life-altering condition. And when it's added to a patient's record, without active management, without their routine provider and doctor knowing that they have the condition, that is creating higher payment without accountability, and it is a danger to patients and providers. Now I'm going to turn our attention to another lesser-known player in the healthcare system that I believe American people should be made aware of: PBMs and PBM GPOs. The largest PBMs, CVS Caremark, Express Scripts, and Optum, have created rebate contracting entities, or PBM group purchasing organizations, which are adding to the complex and opaque nature of the medicine supply chain. My first PBM reform bill on transparency was in 2019 as an Iowa State Senator. PBMs claim these entities provide them and their clients with greater bargaining power to lower costs, but recent investigations by members of Congress, industry experts, state attorneys general, and federal oversight agencies suggest the opposite may be true. We have a graph up here. Let's start with the left. The drug maker, who pays rebates directly to the PBMs and PBM GPOs to ensure their drugs are included on their health plan formularies, meaning the drugs are covered by insurance. Then these PBMs and their PBM GPO subsidiaries collect the rebates, which they promise to pass through to their patients and health plans. Can any of you tell me what percentage of rebates are passed through to the patient who is paying a higher drug cost because the rebates are added to the price of the drug? Is it zero? You don't even know that you're not giving these patients back a rebate for paying higher drug prices. Next, the PBMs pass supposedly the rebates to the health plans. However, the health plans are told 100% of the rebates negotiated by its PBM are then returned to the plan as savings. They often aren't told anything about the PBM GPO subsidiaries, which collect a whole different set of fees from the drug maker in exchange for formulary management. So a health plan might be getting 100% of the rebates the PBM received, but the plan has no idea if the rebate got everything the GPO earned or how much money the GPO may have kept. It begs the question, are PBM GPOs just a cover for the big three to say in a contract that they pass through 100% of the rebates they get, and also a way to keep anyone else from being able to fully access brand drugs? Mr. Joyner, on average in the commercial market, what percentage of manufacturer rebates and fees negotiated through your PBM are retained by your GPO? Or are they going to other subsidiaries or offshore?
Yes, Congresswoman, we pass through 99.9% of the rebates to our customers and feel really strongly about the strength of our purchasing arm. In fact, if you look at the branded products that were rebated.
I'm going to
that were
reclaim my time.
contracted
Mr. Cordani, how many of the, your GPO, Ascent Health, is headquartered, why is it headquartered outside the United States, and do you pay taxes on fees in America?
Our GPO is headquartered in Switzerland. We're a global company, so we leverage our global infrastructure for that GPO.
Thank you. And before I yield
And it
my
is a
time,
full-
why
it is
isn't this
fully
a violation of Stark? As a physician, I cannot do what you all have done with PBMs. With that, I yield.
Gentlelady yield.